Good afternoon, everybody. Thank you so much for once again tuning in to the African Reform Movement channel, where we discuss all things African with an emphasis on Ghana. I am your host, Uche Noka, and as ever, we have Dr. Nii and Darko with us. If you're joining us for the first time, welcome. Thank you for joining us today. Just want to run through a few things with you, which you might not be aware of. Dr. Nii has a number of social media platforms, and you're free to subscribe to any one of these. If you are going to subscribe to his YouTube channel, please remember to hit the notification bell, which is right next to the subscribe tab, and select all, so that anytime we post anything on this channel, you'll be notified about it in good time. Thank you to everybody who has subscribed to his YouTube channel. He now has 68 subscribers, so that's fantastic. Thank you very much. We ask that all questions be sent to our chat function as this episode is going live. Because of how busy Dr. Nii and myself are during the week, we won't be able to go back and look at the comments and look to see if there's any questions there to have them answered. So we ask everybody tuning in today that you send any questions through directly to this episode so Dr. Nii can answer them in real time. Okay. Also, Dr. Nii has written a number of books which can be purchased at the following address, and that's booknook.store/book-author/Nii-Amu-Darko. Okay, all of these details are in the description box below on his YouTube channel, where this is now being streamed live to. So that's all that. So thank you very much. And today we're going to be talking about an interesting topic. Just want to make sure you got it correctly. Delivering health in Santa State, Ghana. Now, what does that mean? Dr. Nii is about to tell us.
It is a very interesting topic. Thank you very much, Uche. As usual, you've delivered the introduction perfectly. Now, health delivery is a very important aspect of a nation's construction. We know that health is wealth. So if a country is not healthy, the country cannot be wealthy. And that's what makes health delivery extraordinarily important. But when we say health, it means more than not going to hospital. All right. Now, I'm going to take you through looking at the health in a very different way, probably in a way that you have never seen before. Because as the case is, Ghana is a developing country, or it's an underdeveloped country. And to make things worse, Ghana is a center state. Santa State is a state that has a Santa Constitution, that has a Santa President who comes around like Santa Claus at Christmas and throws things around for his sycophants. That's what you do in that country, all right? People lie, people talk, and you wonder what's going on, but they need some toys or some what do you call that thing? Lollies from the Santa President. So nobody talks right, nobody talks sensible. Today we're going to talk about health delivery in a Santa State, how it should be redone. All right, first slide, please.
Okay.
Yes, I'm starting from a very funny angle. Health in a Santa State. Now, may the God of peace himself sanctify you completely, and may your whole spirit, soul, and body be preserved blameless at the coming of our Lord Jesus Christ. Now, here the Apostle Paul is telling us that there are three aspects of our being: the spirit, the soul, and the body. And he asks that these three areas should be sanctified completely by the God of peace himself. We should be kept healthy and blameless in these three departments at the coming of our Lord Jesus Christ. So I'm going to talk about health. And there are three aspects of health: spiritual health, mental health, and physical health. Can we please go to the next slide? So what is the scope of health? Spiritual health, which we call now, this is not only a Christian theology, it's very cultural and very traditional. we also believe that the human being has got three parts: sum sum or susuma, kra or kla, and nipadua or bomocho. Spiritual, mental, and physical. So what I read in Thessalonians doesn't pertain to the Thessalonians alone or the Christian dogma. It also applies to the Ghanaian cultural understanding of the cosmos. So we are looking at spiritual health, mental health, and physical health. But today it's on physical health. Bomocho hewale or nipadua hewale. All right, next slide. Physical health. Now we have to understand that health is service. And so when it comes to service delivery, we've got to think about affordability, the cost of the delivery, its availability, accessibility, and its appropriateness. Now, when we're going to talk about health, or the way I look at health, the physical health I'm talking about, is one. How much?
Dr. Nii, we've lost you.
Never?
No, we lost you there. We couldn't hear you.
Oh, sorry. I'm saying that I'm talking about physical health, and as a service, it comes at a cost.
Right.
It must be available, and it must be accessible, and it must be appropriate. So we're going to look at these four areas in physical health delivery.
Mm-hmm.
First of all, I will start from a different angle. I will say that I will commit 10% of GDP to physical health. Now, if our GDP is 50 billion, then I'm going to commit 5 billion to physical health. Now, to improve physical health means we must improve our GDP. So if you go back to the previous lectures or interviews where I talk about intangible wealth, if we are able to implement that, we can double our GDP in 4 years. So they would be working with 100 billion, and therefore physical health will attract 10 billion. Now, once we get the 10 billion, or we get 10% of GDP, how do we go about sorting out our physical health? I will tell you one thing. That I will give 10% of physical health to one thing alone, which is malaria eradication. Mm-hmm. So I'll be giving 1 billion to malaria eradication. Because you know what? When I was in medical school, 55% of all outpatient presentation was malaria. 55%. Okay? And as I'm talking to you today, 32 Ghanaians die every day from malaria. Okay? So now, 32 die from malaria every single day, and it's not a priority. In Africa, 94% of all malaria deaths in the world, 94% of all malaria deaths in the world is in Africa, and it's not a priority for AU. But I want to set an example in Ghana. I want to eradicate malaria, and I'm going to contribute $1 billion a year, and I believe within 2 years we'll clear malaria. When I was in medical school, 3 diseases constitute 75% of all of our outpatient attendance. Malaria 55%, upper respiratory tract infections, and diarrhea 20%. The 3 alone 75%. But you'll be surprised that for most of those who even come with diarrhea, they've had a background of malaria, so their immune system is weak. And the same applies to upper respiratory tract infection. So once you clear malaria, you are going to change a lot of things. Then you free money for other things, because when malaria is not there, children will no longer be absent from school because of illness. Parents will no longer be out of work because they are looking after their sick children, and you change the economics of Ghana just by taking out malaria, which represents 55% of outpatient attendance. So that's the way I look at it. First, fixing malaria. It's a disgrace that after 60 whatever years of independence, we still are sitting with malaria, killing 32 Ghanaians every day, most of them children. It's a disgrace that after 60 years of Africa's independence, we still are dying. 94% of all malaria deaths in the world is from Africa. There is no country in the world that has that monopoly over any disease. So it's a disgrace. We've got to set an example for others to follow that we can deal with malaria. If Cuba can eradicate malaria, Ghana must be able to eradicate malaria. Okay. Now, availability. Availability is making the service available. How do you decide the service? How do you decide availability? So you say that on the EcoFed, let's say we have 3 million people in a state, right? You have 3 million people in a state. So how do you decide what they should? Then you will say, I will tell you that, okay, in the state, we should have 3,000 hospital beds. In a state of 3 million, we should have 3,000, minimum 3,000 hospital beds. Out of these 3,000 hospital beds, we should have 500 tertiary beds. And we should have 2,000 secondary beds. And we
Sorry,
should
Dr.
have...
Can I just interrupt there? In terms of health, what would classify as secondary and tertiary?
Okay, tertiary is specialist health. So when you are transferred from a polyclinic, depending on your disease profile, you may go to secondary health, which is district. Okay. So you have this level of care there in the district hospital. If it's severe, if it's more than what the district can handle, then it goes to the state capital. So it goes to tertiary health.
Got it.
So that's tertiary. Okay. Now we have quaternary. Quaternary is super specialist, but I will come to that later. Okay. But under EcoFed, up to tertiary will be handled by the state. Quaternary will be handled by the country, the national health system. All right. So here we decide the number of beds we want, so we make those beds available. Now, how do you talk about accessible? It's different from available. Accessible means location of industry, where you put the health system that majority will benefit without much hassle. So we look at populations and you decide, okay, this is where you have the bulk of the population. So you're going to put the tertiary hospital in this city. Then you come to a district, you decide that, okay, this is where you have the bulk of the population, this is where you have the road network, this is where transportation to place will be easier. So you're going to put the district hospitals in these places. So you look at those and decide where or what should go where. Now in Ghana, we build hospitals when it's close to elections without considering any of these things.
Okay.
You got to build it where you think it's a marginal seat that you think with the swing of 2%, you could win the elections.
Okay.
So you build it there, and after the elections, nothing happens because it's not accessible to most of the people. Okay. So we look at it and we put the location of industry. That's what they learn in economics in secondary school. Location of industry. You have to put the industry where it will benefit majority. And then, of course, appropriate. I was talking about the appropriateness by talking about malaria. The most appropriate thing to do is to take the big cost to the health system out by investment. And once that is done, you free money in subsequent years for other things. And then you improve the economic activity because the single thing that causes morbidity in Ghana is malaria. Of course, then diarrhea and the upper respiratory infections. But once you clear them, and we'll talk about them, as we go out. Once you clear these fundamental issues, you bring fresh air into the health system because you dealt with more than half, 3/4 of the problems. And it's not hard because it's all environmental health. It's all environmental health. All right. Next slide. So like I said, you have primary health, we have secondary health, we have tertiary health, and quaternary levels of care. So primary, secondary, and tertiary will be under the care of state government. Quaternary is going to be under the care of national government. So you may have a super specialist hospital for neurosurgery or for child neurosurgery or for cardiothoracic surgery or for plastic and reconstructive surgery, very specialized, highly specialized. That will be, so that 99 or 95% of all health will be catered for within a state. And the 5% may then go to the quaternary, which is under the national government and not state government. I'm talking of if we have EcoFed in place. As we have in Ghana now, it's a complete mess. Okay, we don't know what you are doing. But this is a structure that I look at as levels of care: primary, secondary, tertiary, and quaternary. Now, primary is largely what you call polyclinics. They are supposed to be in the communities. And most of the time, when I was a kid, that's the beginning and end of my illnesses. 99% of the time, it was malaria. You go there, if you are very sick, they'll admit you for the day, give you some IV fluid drip, give you your chloroquine, whatever. And when you feel better at the end of the day, you go home. It's a day hospital, largely. Okay. And those ones, in our time, they were managed by health superintendents, or what you call in Australia, nurse practitioners. That system has collapsed in Ghana. I work with nurse practitioners, and they see what you call category 3, 4, and 5. I see category 1 or 2, very sick patients. So when they have problems, they come and ask me. But that system has collapsed in Ghana. But that system was what was used to manage the polyclinics. We've got to re-engage this system, because I can tell, even in a wealthy country like Australia, you can have doctors at everywhere, at every place. And when you're talking of malaria, that my grandmother used to treat at home, then you realize that we can deal with some of these things at lower level of care, and that's what they call primary health care. I can talk about primary health care for a whole day, because it's one of the key things we study in medical school, what we call the health for all by the year 2000. At that time, we thought 2000 was so far away, but it's come and gone, and there's no health for all. It's from the Alma Ata Declaration in 1977 in the USSR then, about providing health. It's failed completely in Ghana. Completely, not only in Ghana, all over Africa, completely failed. But that'll be another day. I'll talk about primary health care properly, how it can be done in Ghana to save money and to be able to put some more money in quaternary super specialist care. Because once you can control primary and secondary care, you have money for other specialist care. But as it is now, we don't have money for anything. All right. So after levels of care, we go to the next level, which is the next slide.
Okay.
Types of care. So we have adults, that's general, women and children. Now, this is very important. Very, very important. In 1928, in Ghana, there was a governor called Gordon Godgisberg, and he built the first children's hospital, not only in Ghana, but in the whole of West Africa. When he built that hospital, he was bringing pediatricians from all over the world to come and work in that hospital in the center of Accra, Children's Hospital. And it was that hospital that they first diagnosed kwashiorkor. That kwashiorkor is now in the world literature as protein energy malnutrition. It was diagnosed in Princess Marie Louis Hospital in the center of Accra. Now, I'm telling you that in 7 years, that hospital will be 100 years. Godgisberg built it when Ghana population was 2.5 million. It was only 68 beds, and Ghana government has not done anything after that. The only children's hospital we have in Ghana is still the one in Kolewoko in Accra, 68 beds for more than 30 million people.
Wow.
Yeah, Gordon Godgisberg. He built Kolebu in 1925-26. He built Achimota in 1925, and he built Children's Hospital in 1928. It was a beehive of pediatricians all over the world to come and see the wonders in Accra. It's still there like that. 68 beds. Instead of building 680 beds Children's Hospital somewhere on the Akwapin Togo ranges, nice, beautiful area outside Accra, they are building a cathedral for a God who doesn't live in buildings made of human hands. Gordon Godgisberg, the imperialists, the colonialists came and he built Children's Hospital that made it possible for protein energy malnutrition to be diagnosed and to go into world literature. So we will have Children's Hospital. Every state will have at least Children's Hospital of 200 beds. Every state will have at least 200 beds of children for research and other things to inform the world, so the world will also know about tropical diseases, things we are treating in Africa. We must produce and contribute to world learning. Then the next one is women. They are special because I was raised by women. So whatever I do, women come first. We have women hospital. We don't have any like that in Ghana. Every state in Australia has a children and women hospital. Every state in Australia. Actually, the Royal Children's Hospital in Melbourne is the second largest in the whole world. Royal Children's Hospital in Melbourne is the second largest in the whole world. We have Royal Children's Hospital in Sydney. We have Westmead in Sydney. We have Royal Children's Hospital in Perth. Every state I go because women.
Mm-hmm.
I've spoken already. Women. We have women hospital everywhere, every state, because it's different. And so that's why they do with all obstetrics and gynecology at the specialist level. That's very important. And we know the reason why it's very important. Then, of course, we have the adults. Of course, if a woman has appendicitis, you don't send her to the woman because the woman hospital is mainly for gynae and obstetrics. Okay, so still, women go to general hospital. If the woman has got a fracture, you don't send the woman. You don't send the person to. You send the person to the general hospital. So we do general things there for both men and women. But when it comes to pregnancy and related issues, they go to women's hospital. Okay, they don't fight with beds with men in general hospital. And when bringing out children, they go to children's hospital. It's different. Administration and everything should be different, and they should be funded separately. Mm-hmm. So when it comes to types of care, we have adults, women, and children. Next level, please. Next slide. Oh no, there's one more before that.
Oh, sorry, yeah.
Goals of care. Goals of care. Why do you have the health system at all? What are the goals? And this is what you will never ever hear from a Ghanaian minister of health or for a Ghanaian government. Never ever from independence. Because there are no goals. Then also everything is political. What are the goals of care? At the moment, our life expectancy is about 65 years. Okay, so you are building a health system that will prolong life. We want to do it in such a way that in 10 years, our life expectancy will be 80. And it's possible. Very possible. Only 3-4 weeks ago, they released an intergenerational report in Australia. And as we speak now, the life expectancy of a male is 81 years, and that for a female is 85 years in Australia. And the intergenerational, in 40 years' time, they are expecting the life expectancy of a man to rise from 81 to 87, and from that of women to rise from 85 to 89. Now, that's the planning. Because obviously, you're not going to make them to tend to Methuselah. They will have to die at some point. But they know that with what they are doing and it's going to increase 6 years for men and 4 years for women in the next 40 years. We are around 65 now. How do we plan that we can also push ours in 10 years' time to 80, which is not too hard? We can do that. Next slide. Now, why do you want to have a women's hospital to look after obstetrics and gynecology? Because, you know what? Our maternal mortality rate, which the number of women who die for every 100,000 live births, is very poor. It is over 300 per 100,000 births. So every 100,000 live births, over 300 women die in Ghana.
Wow.
Yeah. Now, I live in a country in Australia where that figure is 6. Okay, in Ghana, it's actually 308. When you look at 194 countries in the world, Ghana is number 36 from the bottom. As a matter of fact, the first 50 nations are all African. No. 47 of the last 50 nations are African. Only 3 are not from Africa. The last bottom. And Ghana is right there. Nigeria is West, though. Don't worry. So now, why do you want to have women hospital in every state, at least 250 beds? Because you want to bring maternal mortality rate to under 50. If Ghana is 308 out of 100,000, and Cuba is 36, has 36 for every 100,000. So it means that a pregnant woman is more likely to survive 9 times more in Cuba than in Ghana. And when it comes to Australia, a pregnant woman here is likely to survive 51 times more in Australia than in Ghana. Australia is 6 out of 100,000, and Ghana is 308 out of 100,000. We have to, and there's a reason for that, because in Australia, every state has got its own women hospital at that level. So they just, if it's going to be complicated, we have criteria for transfer. If a patient, if it's going to be critical, you think that life is threatened, you move. Transfer, helicopter will come, take the patient there. That's what we need. That's what we need as human beings. That's what we need as human beings.
What's the country with the best mortality rates for pregnant women?
The what?
What's the country with the best mortality rates?
I think Sweden or Switzerland. I think it's 3 out of 100,000. Yeah.
Wow.
3 out of 100,000. Yeah. But yeah, I think Australia is number 7 or number 8. 6 out of 100,000. Yeah. So yeah, that's terrible. 308 Ghanaian women, they die with pregnancy-related issues because there are no services. You don't have to rush to Kolebu. How can Kolebu accommodate everybody? Okay, it's a priority, but you will never hear, because we do things without goals. We do things without goals. And that's the reason why we have to set this in motion as a policy. Okay, then why do we have to have children's hospital? Because we want our under 5 mortality rate to drop to less than 10 in 10 years. And I can tell you that if we can fix malaria, it will drop. At the moment, it's 60. So see, when 1,000 children are born today, 60 of them will die before they turn 5. Okay, what's the figure in the country I'm living in now? Is 5. So Ghana is 60, Australia is 5. And part of the reason is that there's no malaria here, and there are children also in every state in Australia. So children are attended to as quickly as possible. Cuba, that sells only sugarcane. Their number is 6 out of 1,000. So they're operating like an advanced country. Of course, the top of the range is Singapore. I think Singapore is 3. A fellow colony like Ghana, a fellow British colony like Ghana, but you go to Singapore and see the health infrastructure there, and you understand why under 5 mortality is less than 10 days, actually 3, whilst Ghana is 60. So a child in Singapore has a 20 times chance of surviving 5 years than a Ghanaian child. Why is that? Because that's a feature. Nobody talks about that. No government have ever, as a matter of fact, when Atta Lewis was in Ghana as advisor to Nkrumah didn't even know that at that point in time, 300 children could not survive 5 years. It was around 300 out of 1,000 who did not celebrate their 5th birthday. And when they were writing the 5-year development plan, Atta Lewis said, Mr. Prime Minister, we cannot put these bubbles in your plan when 1 out of 3 children before the age of 5. Do you know that, Mr. Prime Minister? We've got problems. Anyway, so these are the goals of the care, to improve the indices. To improve the indices, the overall quality. Now, under 5 mortality rate is the most sensitive index of healthcare, actually, of the general economy in any country. So you see that the advanced countries, they are all under 10. In fact, most of them are between 7 and 3. And you see the poor countries, woo, all over the place. All over the place. We have to improve the indices. Next slide, please. Health research. I was going to title this differently, but I decided to make it health research into plant medicine. You see, all that I've spoken about will cost us what? Money. All that I've spoken about will cost us money. But if there's going to be health finance, what's going to bring money is plant medicine. And once we invest into research to plant medicine, I'm telling you that things will change. Because we have a lot of medicinal stuff in Ghana. A lot. I don't want to go into some of them. But no research. We prefer to go and buy chemicals. Because that's what we have been told. But I can tell you that just investing $1 billion. You see, we don't understand that. We don't understand investment. We don't understand research. But if we can invest $1 billion into plant medicine, we'll get 10 billion in 2 years. The value of what do you call it here in this country? Complementary health or whatever. This health center from China. The market in Australia, just Australia, 25 million people, is 2 billion.
Mm.
Yeah. What do you call them? They have all these health.
Homeopathic?
Yeah, call them, whatever they call them. It's $2 billion annually. And I'm telling you, the medicine we have in Ghana in plants, no research. No research. So one area that I'll focus on is health research. We'll take $1 billion, put it there, bring the medicines out, and we'll get 10 billion in a year. I know, I mean, it's obvious, but we just not do anything. Absolutely nothing. All right. So that's one. What's the next one? Have you forgotten the next slide? What's it about? Health economy. Yes. Health economy. Medical tourism. Look, if you ask to speak today, I think about 20% of our university students in Ghana are from Nigeria. We are going to establish a health system in Ghana that people from other parts of Africa will come as medical tourism. We're going to build a health economy that is going to be fed through medical tourism. So medical health research and health economy, they are going to bring money into our economy, into our health system. That's the way you got to plan, because you got to get the money from somewhere to invest and provide a service. And one key area is, I mean, if we have tertiary hospital in Volta region, tertiary hospital in Western region, tertiary hospital in Upper region, then we can get medical tourism at least from Burkina Faso, from Togo, and from Ivory Coast, because they don't have it. They don't have it.
Mm-hmm.
They're not thinking about it. It's not part of their problem. Nobody talks about malaria. Nobody talks about anything in Africa. Meanwhile, 94% of all deaths are in Africa of malaria. We will build a health system that will become part of our economy. It will bring money, and that is medical tourism.
Thank you, Dr. Nii, as ever, shedding a lot of light on situations and things that people had no idea about. So that's great. Thank you very much for that. Just a quick question from me, first of all, before I go to see what the comments are saying. With the hospitals, the primary, secondary, tertiary, and quaternary, would you have those as four separate sort of hospitals, or would you merge some of them? Because I'm thinking about, to get the ball rolling, there might not be the money there initially to have these separate hospitals, all of these different regions. How would you think of doing that?
Okay, at the moment we have regional hospitals in 10 of our regions, mm-hmm. and we have district hospitals in most of our regions. Okay, but it's not been properly done, in the sense that the regional hospitals are actually not tertiary hospitals. They actually operate at a level of secondary hospitals.
Right.
So, well, some of them, you're going to upgrade them, increase the bed, because I'm thinking of 500 beds. Okay, so you're going to upgrade them, and both in structure wise and personnel. So we have the basic infrastructure in place. Now we are going to have 5 districts per state. I don't believe that at the moment we have 5 district hospitals in region. So probably we have 2 or 3. So we've got to build some more. And we've got to upgrade. So we have the basic infrastructure. Just that it's not well planned, and they don't know. If you ask them, so why do you have 200 beds here and 400 beds here? They can't tell you the reason. Mm-hmm. But we'll say that each state should have at least 3,000 beds. Okay, so if there are 2,000 beds there, then we know we have 1,000 beds more to build.
Okay.
And then we have to share them across the districts. If they have 3,000 there already, then there's nothing to do. We just upgrade them and put more facilities there and put more research into it. You know what I'm saying? So it's not, we are not starting from ground zero. We are putting more emphasis, putting more focus on what they have to do.
Right. Okay.
Well, and then of course they will have to build more polyclinics and then those community health staff and things. You know, we can go into that in details, but I want to give the idea of what the core issues are and what the core strategy should be. Yeah.
Okay, no problem. And just for anybody who's wondering, I think you mentioned, but just to be clear, where would the money come from to start a program of this nature?
The money will come from the GDP, 10% of GDP.
Okay.
Yeah, 10% of GDP. You see, it's all in fact. You see, the last time I listened to the budget of Ghana, that was November 2018. That was the 2019 budget. And do you know how much they devoted for health? 1.2 billion. That time, 1.2 billion. Do you know? Do you know the health for ambulance in my state of Victoria? That 1.2 billion for 30 million people. In the state of Victoria of 6.5 million, ambulance, just ambulance for 6.5 million is 1 billion. I spoke with an ambulance director one time at a meeting, and I said, we're talking, I said, oh, look, as I'm saying, I would like you to come to Ghana to come and help us with the ambulance system there. And he laughed. They said, what's your budget?
Mm-hmm.
You know, because he said, what's your budget? I said, yeah, we can manage. He said, no, what's your budget, Dr. Dark? He knows I was going to answer him. You know, I said, no, but, you know, you tell us because we are different. So, he said, but what's your general budget for the whole country? I had to pretend I didn't know. But in 2018, the budget for the Republic of Ghana was 15 billion. Okay, was 15 billion, 50 billion US dollars. That's the budget for the budget for Australia. 25 million people is 150 billion, 10 times more, 150 billion. All right, that's 10% of Australia's. Actually, it's 200 billion. Sorry, 10% of Australia's GDP. 200 billion. Australia is 2 trillion economy. All right, so yeah, 10%. At the moment, I don't know the percentage because if Ghana GDP is 50 billion and you're giving 1.2 billion to health, then Jesus Christ, it's not even 10% is 5 billion, 5% is 2.5 billion. So they are giving about 2.5% of GDP to health. 2.5% of GDP to health. But I'm going to give 10% GDP to health. So we're starting from that point.
Mm-hmm.
So that's where the money will come from. Obviously, if we're successful health research and medical tourism, we're going to get more money, and then we'll take it from there. But that's the infrastructure, financial infrastructure for my program. 10%.
Okay. Let's go to the comments. Sheikha said that mental health is major. And I have to admit, particularly in African Caribbean countries, it's very major.
It's very major, I know. Mental health, but you see, I separate it to spiritual health, mental health. But today, the focus is on physical health. When we come to mental health, it's going to be different. All right. So, mental health is major, but today it's for physical health.
Okay, but in obviously going forward in the program, there is a place in your mind in your planning for mental health.
Oh yeah, you know that's the second slide. That's the second slide.
Got it.
That's the second slide. The first slide is spiritual health, which the pastors are doing great job in Ghana, and the imams are doing great job in Ghana. Okay, that's spiritual health. They are doing great job in Ghana. Then we have mental health, which relates to the soul. And they have the physical health which relates to the body. Today is for physical health. The mental health will be a different scenario altogether. And you see what I think about mental health.
Okay, no problem. Another comment from Shika. I've no words for your juxtaposition of the absence of a modern children's hospital to the frenzy to build a census cathedral of doom.
Yeah, you know, now Shika is being political. I know the father wrote a poem, The Cathedral of Doom. That was, he wrote it long before, you know, he wrote it, I don't know the year, but probably 30, 40 years ago. So since when the government started talking about the cathedral, that poem has gone everywhere, the Cathedral of Doom. So that's what she's talking about. But on a more serious note, we do not have a modern children's hospital. The one we have was built almost 100 years ago by a colonialist, 68 beds. In Accra, Kolewoko, the most densely populated place on planet Earth. If you know Kolewoko. Noise. How can you have children's hospital? By that time, it wasn't like that. It's completely inappropriate where that hospital is.
What is the purpose of this cathedral? What's the clamor to build a cathedral? I don't understand.
Somebody said he promised he's God. That if you won the elections, it will be the cathedral to thank. I'm not sure.
Yeah.
I'm not sure. That's what somebody said, and the whole country is watching on.
And are they not asking questions as to where he's going to get the money to do this?
Yeah. Well, he's asking his supporters to contribute 100 cedis every month. Can you imagine? Can you imagine a country that 32 children die every day from malaria and related complications? And he's not thinking about that.
I don't get the cathedral. That's crazy. I don't get it at all.
So there we go. But when there is no plan, everything goes. If he has plans, if his health minister has come up with this idea that, boss, we want this for our health sector, well, there will be no money for cathedral. But no plan. You see, you have to have a system when if the president comes and announces or does whatever, State of the Nation address, within the week, the major ministries should come out with their own policies.
Yeah.
About carrying on from what the president has said and what you say about health, education, infrastructure, telecommunication, the major ones that hold the economy, the accolancy of the economy, the pillars, the main pillars of the economy. You should come out and talk about them in the way that will make sense to ordinary Ghanaian, that my government is thinking about my health. My government is thinking, but it's all politics. It's all politics. And that's what's going to happen if I'm given the power tomorrow and I form a cabinet with the 5 senior ministry, super ministry and their 5 super ministers, senior ministers. After my son and State of the Nation address, within a week, they all come and say their super ministry's agenda. So that it will be measured the next year. How far they've gone with what they said they were going to do. Well, if you haven't done that, how far then? But nothing works. Nothing happens. No set goals. People don't even know the goal of the health system. What are the goals? There's no plan to reduce children under 5 mortality. They don't even know about the maternal mortality I'm talking to you about right now. They don't know. Under 5 mortality was so high that in the olden days, they think that these children die and go and come back. Like in Kemifuna, in Things Fall Apart. You actually read the book. So they think people.
I have actually, I did read it. A long time ago, but I did read it, yeah.
Yeah, they think that children go. My grandmother was one of those. We call them in my language, Bo Balo. Bo is dead. Balo is retainer. They think the children died and retained. Because it's so common. At that time, 1 out of 2 children do not celebrate your 5th birthday. We don't know. But for vaccination, which is provided freely by WHO, it should be so like that. Vaccination has improved it. If we take malaria out, it's going to drop drastically. But nobody cares. Nobody cares.
Okay, next comment from Abigail Kwashi. Welcome, Abigail. I haven't seen you on here before. Welcome. She said a very informative lecture, practical to with possible solutions. So that's what she sees that.
Thank you, Abby. Thank you, Abby. Abigail is Shike's friend.
Oh, nice. Okay. Hubert. Hi, Hubert. He says, these are scary figures. Ghana is a pity.
It is a pity. I think the worst country, you know what? This thing is just crazy. The maternal mortality in Ghana, personally, I'm not lying to you, I don't believe the 300 is correct. I think it's worse than that. Personally. Because in my own little place where I grew up from, I know a number of women who died through childbirth or related issues. It's so common. And honestly, and it's scary. When the country I'm living in only sees die out of 100,000 live births. And Ghana is 308, 51 times more. A country, a poor country like Cuba, with only sugarcane to its credit, 36 is not the best, but it's way much better than Ghana. Because there's no plan. There's no women hospital. There's no women hospital. I took my beds and I donated my beds to a maternity home. I took beds, hydraulic beds, put them in container, took the maternity home. 9 beds I gave to them. When I went to visit the next time, they are not using a bed because they don't have power, electricity in the wall to put there. So they were expecting me to come and connect electricity before they put the plug. Because it's electric bed, it's hydraulic electric bed.
Right.
That also maternity home. They celebrated their 90th birthday only. 90th birthday only. It was also built by Godisberg. Godisberg good also maternity home. What other government has done anything? 1928. Godisberg built it because also it's the seat of government. So he saw no, this is not acceptable. So he built it there. It's about 200 meters from the castle, the seat of government. Today, as I'm talking to you, I sent birds there. There's no power. They want me to come and do it for them.
Wow.
Yes. It was Osu Manche who donated birds on my behalf there, the chief of Osu. Birds were there. Nothing. No ambulance. So if there's a problem, what they will take the person before they will get to Kolubu, the patient has died. That's how serious it is. So me, this 308, I don't even believe it. I think it's too modest. Then we have, even now, as we're speaking now, at one point, Rwanda. Rwanda, under 5 mortality, was almost 290 or whatever. Ridiculous. Today, as you are speaking, it's about 40 something. It's better than Ghana. Rwanda. Because there's a purposeful government there. Rwanda. What do we have in Rwanda? I don't know their maternal mortality rate. I don't know their life expectancy or what they call. Yeah. But I'm telling you that I know the under 5 mortality is better than Ghana. And it's going to be even better more because it's a policy that government has set itself.
Yeah. The government's really doing excellently. Really is. As a country, they come up amazingly. Yeah. Yeah, they have. Next question here. What are the African Reform Movement's provisions for aged care?
Madam will kill me. Okay. So when we're going to talk about aged care, can we please talk about special health? I don't want to add it to physical health because it's very different.
Okay.
So because of it, I'm going to create a special category of special health. Now, special health is going to be aged care and disability. Okay, it's going to be aged care and disability. So I'll create a special group for them because you've asked this question. When you read my book, People in Africa is all there. Okay, so I've treated aged care and I've treated special, what do you call them, disability and those ones specially. Actually, there will be a minister for that. So it's very important to me. Just that today I want to focus on physical health.
Okay. Right. So there's a question here. What is a function of CSIR in Ghana? They are paid to do these researches, but nothing. What's a CSIR for someone who's watching who doesn't know what that is?
Center for Scientific and Industrial Research.
Okay.
Center for Scientific, yeah. Huber, it's because it was set up the white man with a different mindset. Okay, we took it up from independence. It became job for the boys. Full stop. Yeah, that's why it was set up. All right, we took over. I think the name was changed in 58. I forgot the first name. It was changed in 58. It became job for the boys. Nothing. No publication. Nothing. It's a terrible state.
Oh.
In Australia, we call it CSIRO. CSIRO here, just go to their website and go and see what is happening. CSIRO. Just go to their website.
Oh.
It's a complete joke.
Abigail Kwashi says, illiteracy levels don't help either.
It's part of the problem.
Mm-hmm.
But those in charge are not illiterate.
That's true. That's true.
You see, everything is leadership.
Mm-hmm.
Abigail, you know my grandmother, she never went to class one, but she's a champion. If you give Ghana to her today, and she'll get someone to translate her, whatever she says in Ghana to English, she will rule better than all of them put together. So illiteracy certainly is a problem overall, but the leaders are not illiterate. And why are we so illiterate still, 64 or whatever years after independence?
Mm-hmm.
When within a generation, people attain 100% literacy rate. Why are we so illiterate? But definitely, yes, in the greater scheme of things, literacy doesn't help.
Yeah. Okay. And Abigail also says, that she has some comments. She says, CSIRO in Aussie is amazing.
It is amazing. Everybody, please go to that website.
Abigail says we must improve the indices, which is what, in agreement with you.
That is without question. Yeah.
Yeah.
That's
and final comment from Abigail rather, the Osu maternity home is still one of the best. My sister was born there. They always staff it with experts midwives. If only we could get more focused investment, policy with goals, smart ones.
Yeah, you know the way it is, Abigail, right? Most infrastructure in Ghana, most of them, they are centered on Osu. So it's like that. It's still one of the best in the country. But for me, it's not good enough. For me, yes, I know. I mean, most of my cousins were born there. I was born in Kolebu. But you see, yourself was born there maybe 45 or whatever years ago. But it's not the same as it is today. You go there. Look, I went there, and the next block of land is the land of the Fletchers, distant family members, right? And they don't use anything. I said, look, the way this place is central in Osu, and this block of land which is there, we can get people to actually even come and build a fertility clinic here. So, oh yeah, this and that. But then I can talk about Osu Veterinary Home forever. Okay. I went and they said, but you can't do, because this is Ghana. This is the center of Ghana. You got this land here. It used to be a Fair Motors. It used to be a panel beater shop. Now it's no longer there. The place is dead. Just go and acquire it. The Fletcher family, they will give it to you. They will build this one there. You pay them rent. You make money. Everybody can come. Everybody comes to anyway for shopping. It's a big thing, but nobody's thinking about it. And if you do that, that's what we call cross-subsidization, okay? If that fertility clinic there, it will cross-subsidize your maternity home. If you get money there, that will come into it to help you do things that you expect philanthropists to do for you. You can't beg forever. You say, oh yeah, idea here. Well, it feels loud because I can't do it for them. I'm busy here.
Mm-hmm. Okay, final comments for this show. Abigail says, the Council for Scientific and Industrial Research does a lot, but no one uses it.
So, like I always say, it becomes 1,000 times 0. Okay, work is done when force moves through a distance. That's what we learn in basic physics. So you cannot stand there and push something that doesn't move in distance. It's no work done. If they do the thing, they should publish it. Because if you publish it, there are investors all over the world who are looking for things to invest into. They should have publications. They should have a vibrant website. And they must have a business liaison officer or somebody like that who will sell the ideas. Mm-hmm. That's what it means. So the research they are doing, which nobody uses, why do we pay them? I mean, you're probably right. But what's the point of coming out with things that nobody uses? They need a business liaison officer or business, whatever they want to call it, to take the ideas to the larger world. There are a lot of Nigerian millionaires. They don't know how to do it. You come and invest in that so that we move forward as a nation. But this is my view. I mean, I can talk about health. I haven't said anything about personnel, how to train people, how to retain people, salary ranges. I haven't said anything. But if you read with North Africa, you find all those things there. This is just to present that I look at health a bit different. We have to start from the cost, okay? 10% of GDP, not the 2.5 we're having now. And they have to talk of where to get extra money from. Health research into plant medicine, medical tourism. There are so many medicinal plants in Ghana that we know we've used. Okay, so we got to look at these things, and it's not so hard. Once you have a structure in your mind, you see that going through them is not so hard. But if there's no structure, everything comes amorphous.
Okay, Dr. Nii, thank you so much for sharing your thoughts on the healthcare state in Ghana and how it can be improved. Thank you to everybody who tuned in and who joined in the conversation and posted questions and comments. Thank you very much. Once again, you're more than welcome to continue the conversation after we log off. But if there's any questions you wanted for Dr. Nii, they'll not be answered, unfortunately, because we just don't have the time. So please feel free to continue talking amongst yourselves, but Dr. Nii would not be able to answer any questions directly for him after the broadcast is over. So once again, thank you very much. Once again, remember to have a look at your social media, connect with him on social media. Go ahead.
Yeah, next week we'll talk about the Fix the Country, okay? Because people have asked me privately, oh, you don't say anything about the demonstration. So next week we'll talk about Fix the Country.
Okay, excellent. Okay, so that's next week's topic. Tune in for that and come ready with your questions. Tell everybody 12 noon, watch this show, okay? Thank you once again. Enjoy the rest of your day wherever you are. Take care then. Bye-bye.
Bye, Shika.